how common is migraine among workers?
Well, it's surprisingly common. And when I was working in my corporate career for about 20 years, I would always think I was the only one. And oftentimes you do think you're the only one because nobody talks about it. But in fact, 1 in 6 US adults also will have migraine, right? So you're clearly not alone. More than 25%, or 1 in 4 women ages 33 to 55, have migraine, which tends to be kind of the peak population for many organizations in the workplace. And then during a migraine attack, 90% of people aren't able to work fully. And any of us who have had a migraine attack at work over and over again can tell you easily that, maybe you can't think clearly. Some people can't see. Obviously, if you're throwing up in the toilet, you're not doing your work, right? So it's easy for us to see the impact that it has upon employers, and easy to see that it's happening across the workplace.
I thought it was important at this point to highlight a term that you introduced me to, as we were preparing for this webinar, the term presenteeism. I think that's critical that we realize the time lost at work that isn't in that actual day off you take for the migraine, but just even when you push yourself to be at work and you're not fully there.
Yeah, I mean, a lot of us are showing up and just functioning and plodding through the day. Oftentimes, I'll be out at a retail store and I'll see somebody who looks a little off, and I'll ask them, "How are you doing? You okay?" And maybe they'll admit to me, because I'm a complete stranger, that they're having a migraine attack. I can almost read it on people's faces, because we get some of the telltale symptoms. And so it's happening more broadly, and this is called presenteeism, when you show up and you're not completely there. And the lost productivity in that in those cases of presenteeism is one of the biggest costs to employers. So when we look at the total cost to employers, the cost of absenteeism when you call in sick, presenteeism when you're there but not completely there, the cost of medication or healthcare or whatever attached to that, actual claims, all those things cost employers, but presenteeism is the biggest cost. So if we can begin to solve this, we can reduce the cost on employers and create a better work environment for people with migraine. A couple of years ago, we did some interviews, which you can see if you look at the migraine journey section of Migraine Again. There are various interviews with people in a variety of occupations: industrial engineers, police officers, teachers, doctors and nurses, business people, the full spectrum. And to hear how migraine affected their work, to me, was eye-opening. When I heard a police officer talk about how she was a danger to herself and others because she couldn't, hold her gun still when she was having an aura and shaking during the early stages of a migraine attack, she had to change careers. She had to change out of that world because she couldn't continue to manage it. But it was equally inspiring to hear a woman who worked in a warehouse, and the accommodations, when she came out and told people that she had migraine, the accommodations that she got from that company were incredible, just awesome. And the support she got from her coworkers was amazing. So every story is different, and each person who's here with us today, and thank you for being here, I know has a story. Some of you are going to have different symptoms than others. Arefa, have you ever experienced any of these symptoms at work yourself?
I've experienced the major ones are the visual disturbances and the language difficulties, and I've experienced them while seeing a patient. And I was thinking about it. I don't know that I necessarily had the insight to understand that these choices I was making in my career were influenced by migraine at the time. But when I was in medical school, I did make a very intentional decision that I would go into a specialty where I could have a Monday through Friday daytime job, that I was not cut out for doing night shifts or evening shifts. I couldn't jump around with my schedule. I had enough knowledge of my health that I needed to get up at the same time, go to sleep at the same time. I needed to be able to exercise every day. I couldn't do long shifts for 12, 15 hours. I needed to be able to stop for lunch and a snack at a scheduled time. So, I mean, it's interesting how it all works out. So I wanted to go into OB-GYN and I did not because of the call schedule. But then I ended up in a primary care clinic where I took care of women. So I was able to really achieve working with the group I wanted to work with, but in a different way.
Well, and that's a great story because at first you talked about healthcare, which is the one of the two largest, along with education, fields for people with migraine. And second, you talked about how you chose a job that was going to be a little bit more manageable with migraine. And you know, as much as we work on our health and try to fix it, sometimes we have to tweak our
Yes.
career path or job choices in order to effectively prioritize our health. So, yeah, I worked in an office setting, and nausea and vomiting were my most disabling
Oh,
symptoms for sure. You know, just I distinctly remember being at a very important luncheon and also being on stage presenting and having to run off stage and go throw up. It comes at the worst times, and you're just trying to fake feeling well. And I'm a pretty bad actress, so I didn't do so well at that.
I had that happen to me at my medical school graduation. Had to leave,
Lovely.
go get sick, and then come back. So,
Lovely. Yeah.
but I think this is a good segue into our next slide. How can the workplace trigger a migraine attack? To really look at not again, part of this conversation is about taking this out of the realm of the individual and really looking at it globally across the workplace, that it's not about the one person and their experience in helping them, but through these changes and recognition of these workplace environments, we can really help everyone and all the people that are silently suffering from migraines. So tell me what you've experienced from this list.
Well, first of all, bright lighting, fluorescent lighting, I'm very sensitive to that. Anytime I'm in a workplace that has that, I react to it. I think that because education and healthcare tend to be, you know, hospitals and classrooms are, you know, notorious for having really bad lighting. That's something that affects a lot of people. Like 85% of people are sensitive to have some light sensitivity. Stress, gosh, you know, healthcare has got to be a pretty stressful space. For my work in business was very stressful. And it's not on this list, but flights. I traveled a lot and crossed time zones all over the world. And that was a big trigger for me because of the inconsistent sleep. So it's an outlier, but it's there. Screen use is increasingly a problem for people. We're going to talk about that a little bit later and ways to come around it. Bad posture, poor diet, not taking, skipping meals, not taking time to eat really good quality food. Sharp smells or fragrances are the devil in the office or in any workplace when you're working next to somebody who has on a little bit too much, you know, Old Spice, and they don't realize that it can send you to the hospital. And then inflexible working hours, where just the stress of having to be there and punch in by a particular time for a lot of people is really, really hard when, you know, things come up and detain them.
I do feel like I've experienced all of these at some point. And sometimes I put up with it and sometimes I take the time. I think when the days are going well, then I have that quiet time to reflect and really then recognize the trigger and change it and take the time. Like, for instance, the bright lighting. I mean, it really, I'm working from home, so it's really on me to make sure my lighting is appropriate, and to let the correct people know if I need a certain screen guard, or I need help adjusting to dark mode on my web pages.
Yeah, I think the pandemic has actually been a huge blessing because for people who have those kinds of jobs that they can do from home, the ability to control some of your own workplace triggers has been fantastic for many people. So I'm grateful for that. And now we're Many are going back into the workplace and dealing with it all over again.